Professor John Idoku, you're welcome to Question Time.
Thank you very much.
Now, let's start right away looking at the mandate of the agency, NACA. It has a broad spectrum of or that's to coordinate the broad spectrum of HIV and AIDS response. Now, how have you been able to interface with all stakeholders, or should I say concerned individuals, within the health sector in curbing this trend?
First, it's more than the health sector. But let me probably expand the mandate. We have a huge mandate, but three are extremely important. We call them the 3 ones. And those three is, you've mentioned one. Before you coordinate, you've got to have a plan. You've got to have a policy. So we as an agency develops the policy and the plan, a strategic plan for HIV for the whole country. That's cardinal. The second thing is, having done that, we coordinate the activities which come out of this plan across, 4 main sectors. And these sectors are the public sector, the private sector, the civil society sector, and then, our various development partners. And then, having coordinated it, in order to show that the activities are yielding results, we need to monitor and evaluate them. So monitoring and evaluation across all the sectors is also something that we coordinate. There are other, less important mandates, like bringing research to the fore. We coordinate research, we mobilize resources, but those first three are extremely important. We call them the 3 ones. And it's across the whole nations of the world where, HIV is an issue.
Now, can you tell us, in terms of the policies and programs and projects directed at the, issue of enlightening Nigerians on HIV and AIDS, what has been done in that area?
Well, like I said, our job is coordinating across 4 very important, huge sectors. And we do not implement, but we coordinate, and we develop the policy and the plan. For example, in 2010, we developed a strategic plan, that took us from 2010, and then it's taking us to 2015. And out of this strategic plan, every other person buys into it. And this strategic plan was actually developed from ground up upwards. What I mean is that we went around all the 36 states and the FCT. They developed their own plans, and we fused it at the top to develop what is a strategic plan for the country. So all our partners, in order for us to be speaking the same voice and acting in the same way, have to develop their own operational plans on a yearly or 2-yearly basis from this strategic plan. So, for example, the USG, which has one of the largest program on HIV/AIDS among our partners, the PEPFAR program, which is the Presidential Emergency Plan for AIDS Relief, they've got to develop their plans out of our plan, because, as you know, we lead, if we're leading in all these plans and policies as a government, then they have to buy into it. And all other civil society, we have many civil society entities, we have a number of networks, and they all have to do the same. Pt.1, for example, which is the network of people living with HIV/AIDS. We have CISAN, which is the civil society group. All these have to, everyone, buys, and even NACA itself have to now develop their operational plans from this huge plan. Only recently, we were directed by the president, to develop a 2-year operational plan that will lift, what we are doing to near what we call the universal access targets for this country. And we've just developed that. The president launched it at a huge summit, that took place in July, the Abuja Plus 12 Summit. I guess, something we can talk about. So that is called the President's Comprehensive Response Plan on HIV/AIDS. So you can see all this have to come out of the strategic plan that we have.
Now, with the assistance of the Leadership Enhanced program, looking at it generally, I mean, in all this talk of trying to ensure that HIV and AIDS is curbed, reduced to the barest minimum, from your own vantage position, do you think that the present government is showing a whole lot of seriousness, in trying to, reduce the scourge?
Well, my answer is, if I take the federal government, obviously yes. The government at the center has committed itself and is recommitting itself. And that's why the president now directed us. The president said, I don't want anybody to die of HIV/AIDS. That's reminding us of the zero new infections, zero AIDS-related deaths, and zero stigma. And, directed us to go and produce a comprehensive plan to ensure that we meet our universal access targets. And universal access targets means ensuring that 80% of all those in need get, the interventions that are required. If it is prevention, we make sure that 80% of the population get it. For example, testing. If it is treatment, all those who require treatment, 80% of them will get it. If it is transmission, interruption of transmission of, HIV from positive pregnant women to their babies, in fact, that is 90%. We call that elimination of, transmission of HIV from, mothers to children. So those are the universal access targets. Having said that, where we really have problem is at the level of the states. And the states are critical. Why? Because it is the states that make the local governments that make, and it's in the local government you have the communities. And that's where everything plays out. That's where HIV is transmitted, and that obviously should be where we should be interrupting HIV. So the states must own, drive, and lead, the response. Otherwise,
in other words, you're saying the states really have to, show more commitment.
Absolutely,
besides
absolutely.
the federal government now.
Absolutely, that's exactly what I'm saying. But we're putting structures together. We're working very hard with the states, and we have a new strategy. We have sort of like, reviewed our strategy in the light of, what we need to do to ensure that we can get to the states, that the states lead it, and that the states drive it. In fact, in the last 8 months, we've had 2 meetings with the president and the governors, and that message seems to be getting out to them. And in fact, we're already seeing leadership, from the states. So we're pretty happy about, the momentum that is going on.
Now, Professor, does it even still baffle you that a whole lot of Nigerians still believe that there's nothing like HIV and AIDS in existence?
Well, I wouldn't say it baffles me. The reason is that we live in, a very multicultural society. There are a lot of people who still believe that most illnesses come out of their enemies or spirits or somebody who is after them. And it makes it very difficult. I remember in the early days of HIV, Uganda was a lead. And the same type of issues here. If you go to your village and ask people, someone who has classical symptoms of HIV, they will tell you, no, it's some kind of spirit or it's some kind of enemy or something. But they used to say in Uganda that that in a community there are some illnesses that are caused by, evil spirit, but HIV is not caused by it. And I think that's where we need to go. We need to really come out. It's because of the stigma and the discrimination that's pervading the place. But that also is changing a lot. I know 10 years ago, it was like HIV was a death sentence. And at that time, because of the fear, the shame, and that shrouds, the illness, it was dreaded. But it's not the same today. It's a chronic illness. You can live a completely normal life on your drugs like you would live if you were taking your drugs for hypertension or diabetes.
Now, are these drugs available or are they affordable, for millions of Nigerians?
The drugs are completely free, and they're not only free, but I have seen the transformation of the drugs. Technology has shown, and I keep saying, 10 years ago, people were taking like 10, 12 tablets a day. Now you need to take not more than 1, not more than 2 tablets a day, and that has changed the picture. So the drugs are more convenient, they are more potent, they have less side effects, and that obviously should help people to live well. And our studies have shown clearly that if you are 25, when you develop HIV, you can live up to 80 if you take those drugs as and when due. That's well proven. And I can tell you that in my own small experience. There are people that I started treating in 2000, and they're all looking well, they have families, they're at work. So there's no doubt that even though we don't have a cure, this disease can now be managed like any chronic illness, diabetes or hypertension. By the way, they are even related in a way.